I want you all to try something with me. I want you to try everything that you can possibly think of doing, every thought process you can think of, mental gymnastics you can do, to try really hard, do your best in these next few moments to try not to think about a banana. So that's the goal, try not to think about it. How's it going? What are you noticing? Check in for a minute. What are you noticing about trying not to think about a banana? A lot of people notice the image of a banana in their head. It won't go away. A lot of other people notice they can even start to smell or even taste a banana. Or they might even think about monkeys because monkeys think about bananas. So there's all of this kind of thoughts that are connected to this banana that you're trying so hard not to think about. Now, this is a normal human thing. If we try not to think about something, our mind has to know what it is we're trying not to think about. So we can't do anything to try not to think about these things. Now, we're talking about bananas, but the reality is some people have a very, very hard time with this process. People with trauma, people with depression, people with really problematic self-esteems, people whose lives are falling apart deal with this very same problem. The thoughts that they're having are getting in the way, they're disruptive, they're painful, and they can't stop thinking about them. You can't do anything consciously to get rid of them. In fact, it tends to be stronger. So some people really need an additional help. Some people get stuck in their lives because of these thoughts. So the solution here, so go back to banana. The solution here is to just decide it's okay to let banana hang out there, the thought about banana hang out there, and do what matters. Do whatever it is you're doing. If you're doing the dishes, do the dishes. If you're cleaning the kitchen, clean the kitchen. If you're doing work, just do work. And oh yeah, there's banana. Oh yeah, there's banana again. The solution is just to let banana be there, and eventually it'll go away on its own. We have an intensive outpatient therapy program as part of our clinic that is designed around this very process that helps people unhook from these difficult and painful thoughts and get in touch with who they are in the present moment and move towards a life that they can live and that they want to live. It's a process called acceptance and commitment therapy, where you accept the thought of banana or the thought of trauma or whatever. You get in touch with the present moment and you commit to living a life that is worthwhile to you. So our group is 4 days a week for 3-hour sessions, starts at 9 a.m. and goes until noon, Monday through Thursday. And we also require weekly individual therapy with a member of the Intensive Outpatient Program team. We follow a curriculum. We do experiential exercises that are designed to illustrate the different pieces of ACT. So if you or a loved one is really stuck in this kind of process, plagued and controlled by these difficult thoughts and feelings, give us a call. Let our receptionist know that you're interested in the acceptance and commitment therapy intensive outpatient program. And if you happen not to be in the Twin Cities, Google acceptance and commitment therapy and get the help you need.